You're very busy right now, and I really, really appreciate you taking some time to talk with us. Again, we're talking with Roman Golash, who his background professionally is in microbiology, worked for, or served in the U.S. Army, also served with the Illinois Department of Public Health, although retired a few years ago, and is still currently working in the medical field in response to COVID-19. What should, if one family member starts getting some symptoms, what should they do? Is it inevitable that everybody in the house is going to get it, or what do you recommend?
No, it doesn't mean that everybody in the house would get it, but coronavirus.gov suggests several things. Number one, if a person begins to have symptoms and they're not severe, then they should go be self quarantined in one of the rooms in the house and should stay away from the other members of the house. Now, this is where it gets a little bit trickier because the key symptoms that they're looking for is fever, shortness of breath, coughing, headaches, and there's a constellation of other symptoms. So you have to be careful about that. But once you get the fever, then it is suggested that the person call their physician and make sure that they know what's going on, and the physician is going to manage this person initially by phone, and then if it gets worse, then the physician will tell the person to go to some hospital that they might have to go to. It's not inevitable that a person gets the virus and tests positive and may never have symptoms. The person may be positive and get slight symptoms. And then there are those which, unfortunately, with underlying diseases in most cases, and elderly, where it can be fatal. All these different epidemiological parameters that we're talking about is something that is still being investigated in ongoing investigations. What we do know that at the various medical centers in our area, the healthcare workers are screened before they come into the hospital, see if they have any symptoms, and if they do, they're sent home. So the quarantine is, in some cases, 14 days, but you can get the symptoms after 2 days after exposure, up to 7 days. Originally, it was thought that the virus particles would spread quite a lot of them before symptoms. Now, research is showing us, according to CDC, that the viruses spread the most during these symptoms, that before symptoms occur, there's less occurrence of spreading the virus. Also, the virus can exist for a while on tables, on doorknobs, so family members have to be advised of this. But there is no reason why the whole family has to get it if one person has it. The only caution is if the fever goes too high and then the coughing becomes severe with shortness of breath, that they need to seek medical care. Be cognizant of washing your hands. Don't touch your face. Wash your face with soap. If you don't have soap and water, which is the best, use some kind of sanitizer with at least 65% alcohol. But what's most important is that we just become aware.
But what's so unique about this coronavirus and why it is so contagious?
Well, we think that, but first of all, it is a little bit more contagious than the other viruses, and it is more readily transmissible for some reason on droplets than the flu, so they say. But I believe from the readings that I've done is that this virus has these spikes on it, and it kind of creates a kind of crown and that's where its name comes from the sun, the corona, and that's where it gets the virus. So somehow those spikes are more efficient in attaching the cells so that then the virus can inject its RNA into the host cell and start taking it over and replicating. Well, let me take you back a couple of years to the 1918 when we had the swine flu epidemic. People forget that we lost 60 million people across the whole globe. It was unbelievable. People also forget about the Hong Kong flu in 1968, where we lost more than 2 to 3 million people across the globe. And also what you mentioned, the H1N1, which was 2008, in which we had 500,000 people dead across the globe. And I think the difference here between these, for example, 68 and 2008, is that now we have a virus, I believe, in my opinion, that this one somehow seems different. Because science and scientists have studied the flu for a long time. They feel comfortable with it. They feel more comfortable it changing from H1N1 to H2N2, et cetera, et cetera. And based on those changes, we would develop the flu vaccine. Now, the flu vaccine can be very effective, semi-effective, or not so effective. And we've seen these different ones because scientists have to guess what's going to hit them the next season.
Okay.
And with this coronavirus, which I mentioned initially originally was just a head cold, how does it morph into something it is today? And I think that element of it is what's perplexing to scientists. And I think that's one of the reasons why people feel that it's better to do more than less. And Dr. Fauci from NIH stated this clearly many times. Our scientists are looking at vaccines because there's a chance that once we flatten the curve and we kind of go back to work again, the people are concerned this virus might come back, just like we have flu coming back. So I think the unknown with the development of these coronaviruses is what's causing a lot of angst in the medical community.
And I want you to talk about, since you are still serving in the medical field, talk about some of the heroic stories you've seen, or just some of the ways you love America as I do. And right. Can you cite a couple of examples you've seen in just the last few weeks that really demonstrate how we are as Americans, working together and or have just been very nimble in as nimble as possible in responding to the current threat.
Tom, I think this is the kind of situation that is unfortunate, but you also see how people can be the best they can be. I think they rise to the occasion. You have in our area here doctors, nurses, laboratorians going to work every day, not staying home, and not trying to self-quarantine themselves. They're out front. They're, as I call them, the tip of the spear in all of this. And I think that really makes me proud of our nation. It makes me proud of people who care for other people, even though there might be some danger in it. And I am very proud of the first responders, our fire department, our police department, all working together in order to help others, in order to eliminate this invisible enemy that we have, this virus from Wuhan.
And what are some other ways that we, just as lay people, can help those first responders or those working on the front lines in the medical field?
Well, I think it's what you're doing. I think you're reaching out to the community and seeing who needs help. You know what I mean? There might be, if you know a neighbor who's elderly, has a another condition, heart condition or diabetes, see if you can pick them up some food, or go to the pharmacy and get their medicines if you can, in order for this person not to be possibly exposed to the virus. I'm very optimistic, Tom, that we're going to lick this virus and we're going to become a better country. I think with the leadership of President Trump and Vice President Pence, we'll come out of this stronger, better, and I guarantee you, I believe we'll be better prepared for the next enemy that tries to strike us.
Well, Roman, I really appreciate you taking a few minutes out to inform me, inform our viewers back at home. Thank you for being on the front lines and for continuing to serve, even though you've retired now twice. You know, you're still in.
I may get mobilized again. Who knows?
Yeah. So I'm just very grateful to you. And any closing remarks that you have?
Well, I think the closing remarks would be that we have to remember that we are one nation under God. I think we have to remember to pray to the Almighty. I think we have to be vigilant, and I think politicians like yourself, Tom, have to be clear in vision and also in what they need to do. And as you mentioned, I think it's time to put aside our differences. I mean, it doesn't make any sense. And to work together in order to solve this crisis. And I think it's doable. I'm very optimistic about it. And I look forward to the resolution, Tom, that we can get together and enjoy some time with our families and have groups together.
Yeah. Yeah. Likewise. All right,
Yeah.
Roman, take care. Thanks
All
again,
right.
and get some rest. I know you're busy.
I will.
Yeah, great. Thank you.
All right, Tom.
Take care.
Thanks.